Welcome back, everyone, for another deep dive. This time we're focusing on steroid-responsive meningitis-arteritis in dogs.
SRMA.
SRMA, thank you. You sent over some fascinating research, particularly a recent UK study that used MRI to really examine this condition. And it seems like you're interested in how SRMA presents on imaging.
Yes, absolutely. While SRMA is relatively common, we still don't fully understand how it shows up on MRI
Yeah.
and what those findings actually mean for a dog's long-term prognosis.
Right, and this study really tries to tackle that. It looks at MRI findings in 53 dogs, all from the UK, who were diagnosed with SRMA.
Yeah, this was a multi-center retrospective study, so they pulled records from different veterinary hospitals.
Yeah.
And all the dogs had a presumptive diagnosis of SRMA based on their symptoms, and of course they had all undergone an MRI as part of their workup.
Okay, so before we jump into all those MRI findings, can we just quickly recap the typical signalment and presentation for SRA? What kind of dogs are we typically seeing with this condition?
Sure. Typically, SRMA affects young dogs often less than 2 years old.
Okay.
The median age in this study was actually only 12 months.
Wow.
Certain breeds, like beagles and boxers, seem to be predisposed.
Oh, interesting.
And the most common clinical signs we see are fever, lethargy, neck pain, and spinal hyperesthesia.
And just to remind our listeners, spinal hyperesthesia just means that they're very sensitive to touch along their spine.
Exactly.
So you're really looking for those signs of pain and inflammation when you're examining these dogs. Now, did all the dogs in this study present with just spinal pain? Or were there some who had those more severe neurological deficits?
Yeah, that's a great point. Not all dogs with SRMA present in the same way. So while spinal pain is the hallmark,
Right.
about 15% of the dogs in this study had more severe neurological signs like paresis or even paralysis.
Oh, wow.
Yeah, so there's definitely a spectrum of how these dogs can present clinically.
That's really interesting. All right, so let's get to the heart of it. What did this study find on MRI? What were those key findings?
Well, the most common finding, which we saw in over half the dogs, was actually outside the spinal cord itself.
Really?
They found changes in the paravertebral muscles.
And those are the muscles that run along the spine.
That's right.
So the inflammation wasn't always directly visible in the meninges or the spinal cord.
Yeah, that was surprising. These paravertebral muscle changes showed up as hyperintense areas on certain MRI sequences.
Hyperintense meaning what?
Meaning bright areas on the images. And many of these areas also showed contrast enhancement, indicating active inflammation.
Okay, so inflammation in the muscles around the spine was a key finding.
Yeah, one of the key findings.
What about the meninges themselves? Did they see evidence of inflammation in the meninges?
Yes, they did. Meningeal contrast enhancement was seen in about a third of the dogs who received contrast during their MRI.
Okay, so that finding at least confirms what we clinically suspected, right? That there's inflammation in those membranes surrounding the brain and spinal cord.
Exactly. And then, importantly, about 28% of the dogs actually had abnormalities within the spinal cord itself.
Okay.
And these were visible as hyperintense areas on T2-weighted images.
And so this is a significant finding because it suggests there's more direct involvement of the spinal cord, right?
Yeah.
Which could explain why some dogs have more severe neurological signs.
Precisely. If the inflammation is directly affecting the spinal cord itself, it's going to cause more noticeable problems.
Right. That makes sense. Were there any other noteworthy MRI findings in the study?
Yes, a small percentage of the dogs, about 9%, had evidence of hemorrhage on their MRI.
Oh, wow.
And this finding is concerning because it can be associated with those more severe neurological deficits.
So even though we typically think of SRMA as a disease of the meninges, it sounds like that inflammation can extend beyond the meninges and actually affect surrounding muscles and even the spinal cord itself.
That's one of the big takeaways from this study. It highlights that SRMA is a systemic inflammatory disease.
Yeah.
While it primarily targets the meninges, it can definitely involve other tissues as well.
So we're getting a much more complete picture of how this disease can actually manifest. But I'm curious, what does it mean for the dogs themselves? Did the study look at whether these MRI findings actually had any impact on prognosis?
They did. The good news is that almost all the dogs in the study survived to discharge.
Okay, good.
But they also looked at whether specific MRI findings, like the presence of spinal cord lesions or hemorrhage, were associated with a higher risk of relapse.
And what did they find? Were those more severe MRI findings linked to a worse prognosis?
Well, that's the burning question, isn't it? Unfortunately, this study didn't find a clear association between any specific MRI finding and the likelihood of relapse.
So even if a dog has hemorrhage or spinal cord involvement on MRI, it doesn't necessarily mean that they're more likely to have those recurring symptoms.
That's what this study suggests, but it's important to remember it was a retrospective study with a limited sample size.
Right.
So more research is needed to definitively answer that question.
Okay, so we've got a lot to unpack here. It seems like while this study doesn't give us all the answers about prognosis based on MRI findings, it does give us some valuable insights into how SRMA can present on imaging.
Absolutely.
Can we maybe dive a bit deeper into the specifics of those MRI findings? I'm particularly interested in those paravertebral muscle changes you mentioned.
Sure. Let's take a closer look at those.
Great. Before we do that, though, let's take a quick moment to regroup, and we'll be right back to continue our deep dive into SRMA.
Okay, so those paravertebral muscle changes, remember, those were really common in the study.
Right, more than half for dogs.
Yeah, and I think it helps to really visualize what we're looking for on those MRI scans.
Yeah, can you walk us through that? Like, what are vets actually looking for when they're evaluating these muscle changes on MRI?
Sure. So imagine you're looking at a black and white image of the spine. In a healthy dog, the muscles would appear as shades of gray. But in dogs with SRMA, the affected muscles often show up as brighter areas, almost white on certain MRI sequences.
And that's what you mean by hyperintense.
Exactly. That's hyperintensity.
Okay, so brighter areas, bad news, basically.
Yeah, it signals that something's off in those muscles.
Yeah.
And the MRI sequences that we use can tell us even more about what's going on.
Okay.
STRR and T2-weighted images, those are particularly good at highlighting areas of fluid and inflammation.
No?
So when we see those bright, hyperintense areas in the paravertebral muscles on those sequences, it's a strong indicator of inflammation.
It's like a spotlight.
Yeah, exactly.
Highlighting the problem areas. Now, you mentioned that many of these areas also showed contrast enhancement.
Right.
Can you explain what that means and why it's important?
Sure. So contrast enhancement helps us visualize areas with increased blood flow and leaky blood vessels, which often occur in areas of inflammation.
Okay.
So we inject a special dye called gadolinium, and if an area lights up after that injection, it suggests that there's active inflammation happening right there.
So if those paravertebral muscles light up after the contrast, it's another sign that points to SRMA.
Exactly. It really strengthens the suspicion that those muscles are involved in this whole inflammatory process.
Okay, that makes sense.
Yeah.
What about the meningeal contrast enhancement?
Yeah.
What are vets specifically looking for when they're assessing that finding on MRI?
So with meningeal contrast enhancement, we're looking for that same bright signal that lighting up, but this time it's in the meninges.
Right.
Those membranes that surround the brain and spinal cord.
And those become more visible because of the inflammation.
Exactly. So normally the meninges are very thin and they don't really enhance much with contrast.
Okay.
But when they're inflamed, they become more permeable so that gadolinium can leak in. And that makes them show up brightly on those post-contrast images.
So the inflammation makes those membranes really stand out on the MRI.
Yeah, it's like a beacon.
And that's a pretty clear sign that SRMA is at play.
Absolutely. Meningeal contrast enhancement is a hallmark of SRMA. It really provides strong visual evidence of that inflammatory process affecting the meninges.
Okay, that makes sense. Now, you mentioned earlier that some dogs had those abnormalities within the spinal cord itself.
Right.
Can you describe what those look like on MRI?
Sure. So in about 28% of the dogs, they saw hyperintense areas within the spinal cord itself on those T2-weighted images.
Okay.
And this means that parts of the spinal cord were actually showing signs of inflammation or damage.
And I'm assuming that's a much more concerning finding because it means the inflammation is directly impacting the spinal cord itself.
Yeah, exactly.
Potentially affecting its function.
Right. And that's why these dogs are more likely to have those more severe neurological deficits.
It all ties together. Now let's talk about the hemorrhage that was observed in some of those dogs. Why is that finding so concerning?
Hemorrhage or bleeding, that's a serious complication that can happen with SRMA.
Right.
It happens when blood vessels get damaged and they start leaking blood into the surrounding tissues. And this can lead to compression or damage to the spinal cord itself,
Okay.
resulting in those more severe neurological deficits.
So how does hemorrhage actually appear on MRI? What are you looking for?
So hemorrhage looks different on MRI depending on how old it is. Fresh blood, like within a few days, can actually appear very bright on T1-weighted images and dark on T2-weighted images.
Okay.
But as that blood ages, it goes through all these changes and it creates all these different signal patterns on MRI, which can sometimes be tricky to interpret.
So spotting hemorrhage on MRI sounds like it requires a bit of expertise.
It does. We often use these special MRI sequences that help us really identify hemorrhage.
Like what?
One of these is called a T2 weighted or gradient echo sequence.
Okay.
And this sequence is very sensitive to the presence of blood products.
Mm-hmm.
And it creates these areas of signal loss or black spots on the images.
So black spots, red flag for hemorrhage.
Exactly.
Yeah.
And then the location of that hemorrhage is also really important.
Okay.
It can be within the spinal cord itself, what we call intramedullary,
Mm-hmm.
or just outside the cord, but still within the duramater, which is intradural, extramedullary,
Right.
or even outside the duramater in the epidural space.
Wow. So many different locations.
And those different locations can really influence the clinical signs and, of course, the prognosis for the dog.
So all of these MRI findings, the paravertebral muscle, changes the meningeal enhancement,
Yeah.
the spinal cord abnormalities, the hemorrhage, they really help paint this picture of the severity and the extent of the inflammatory process in SRMA.
That's a great way to put it. It's like putting together a puzzle,
Yeah.
using all these pieces of information to get that complete picture.
Now, you mentioned earlier the study also looked at CSF analysis.
Right.
How does that fit into the whole assessment of SRMA?
So CSF analysis, that's a crucial part of the diagnostic workup for SRMA.
Okay.
Remember, CSF is that fluid that bathes the brain and spinal cord.
Right.
And by analyzing a sample of that CSF, we can look for evidence of inflammation,
Yeah.
like elevated white blood cell counts or protein levels.
So if a dog has those characteristic MRI findings that we've been discussing, and then their CSF analysis also shows signs of inflammation, it kind of strengthens that diagnosis of SRMA.
Absolutely. It provides further confirmation that we're dealing with this inflammatory process affecting the central nervous system.
And the CSF findings can also tell us a bit more about how severe that inflammation is.
Exactly.
Okay, so this is all super helpful in understanding how vets actually diagnose and assess the severity of SRMA.
Mm-hmm.
But what does it all mean for prognosis? We touched on this earlier, but can you elaborate a bit more on what this study found regarding the relationship between the MRI findings and outcomes for these dogs?
Sure. One of the main goals of this study was to determine whether specific MRI findings could predict which dogs were more likely to relapse.
And did they? Was there any link between a specific MRI finding and relapse?
Well, that's the crux of the matter. And unfortunately, this study didn't find a clear answer. They didn't find any specific MRI finding that consistently predicted a higher risk of relapse.
So even if a dog has a more concerning finding on MRI, like that spinal cord involvement or hemorrhage, it doesn't necessarily mean they're more likely to have a recurrence of symptoms.
That's what the study suggests. But again, it's important to remember this was a retrospective study with a relatively small sample size.
Right.
So we can't definitively say certain MRI findings mean a worse prognosis, but we can't rule it out either.
Okay. So while this study doesn't give us all the answers, it definitely highlights the complexity of SRMA and the challenges in predicting those long-term outcomes.
For sure.
Before we wrap up, I'd like to maybe discuss some of the limitations of this study
Okay.
and explore some potential avenues for future research.
That sounds good.
Okay, so we've been talking all about this UK study looking at SRMA in dogs and their MRI findings.
Right.
It's fascinating. But like you said, no study is perfect.
No, definitely not.
Can you maybe walk me through some of the limitations of this particular research?
Sure. One of the main limitations is that it was a retrospective study, meaning they were analyzing data that had already been collected. And that can make it really hard to control for all those variables that might influence the results.
So it's more about observing associations than actually proving cause and effect.
Exactly. So, for example, we saw that dogs with spinal cord abnormalities on MRI,
Right.
those dogs were more likely to have paresis or paralysis.
Right.
But it's really tough to say for sure whether those MRI findings directly caused the neurological problems or if there were other factors involved that we just weren't able to account for.
Okay, yeah, that makes sense.
Yeah.
Were there any other limitations that we should be aware of?
Yeah. Another big one was the variation in MRI protocols and equipment
Okay.
across the different veterinary hospitals that participated in the study.
Right.
So that lack of standardization could have impacted the sensitivity and consistency of the findings.
I see. So some centers might have been using those high-field MRI machines, which generally give you much more detailed images.
Exactly.
And others might have been using lower-field machines.
Right. And that could lead to discrepancies in the results.
So it's possible that some subtle abnormalities might have been missed.
Absolutely. Especially if they were using a lower field MRI machine.
If they were in areas that weren't specifically targeted based on the dog's symptoms.
Exactly.
Yeah. So there's definitely room for improvement in terms of standardizing those imaging protocols.
Right.
And maybe even using more advanced imaging technology in future research.
I completely agree. Ideally, future studies would use a prospective design
Okay.
with standardized protocols, larger sample sizes, and longer follow-up periods.
Yeah, get as much data as you can.
Exactly. That would give us much more robust conclusions about the prognostic significance of all those different MRI findings.
So this UK study, while definitely insightful, is really just a starting point.
A stepping stone.
In our understanding of SRMA and how it presents on MRI, it raises some really interesting questions
For sure.
that I think warrant further investigation. What are some of the key unanswered questions that you think this research really highlights?
Well, one of the biggest ones is whether those specific patterns on MRI can actually predict which dogs are going to relapse or what their long-term outcomes are going to be. If we could identify those patterns, it would really change how we manage these cases.
Yeah, that would be huge.
Yeah.
You could potentially tailor treatment plans and monitoring strategies based on a dog's individual MRI findings.
Exactly. It would allow for much more personalized medicine.
That's really exciting. Another exciting area for future research, I think, is the use of even more advanced imaging techniques like diffusion tensor imaging or functional MRI.
Absolutely. Those could provide even more detailed information about the structure and function of the spinal cord in these dogs, potentially revealing subtle changes that we just can't see with conventional MRI.
So we're basically constantly refining our tools and our techniques to get a clearer, more comprehensive understanding of what's actually happening within the nervous system.
Precisely. And as we learn more, we can continue to improve the diagnosis, the treatment, and the management of SRMA and all these other neurological conditions that affect our canine companions.
Absolutely. Well, this has been a fantastic deep dive into the world of SRMA. I feel like I've learned so much about this condition, particularly how it presents on MRI. Thank you so much for sharing your expertise and guiding us through all of this complex research.
It was my pleasure. From Vet Neurajar, keep those minds inspired, hearts light, and tails wagging.